Good night. Yours truly, Professor Dolphy Gilpin, here in Decatur, Georgia, in the Family Lecture Theatre. And we'll continue with our series lecture here in biology and anatomy and physiology. And the last time what we did, we looked at the eye from an anatomical perspective and a biological perspective. Today we're going to look at it from a physiological perspective. And in addition, we have also added some optics or some optometrics to this dimension. So we are looking at we're using the same diagram here now. But what we're going to do, we're going to be looking at the function of every component here, like the fovea, the choroid, the retina, the cellular, the lens, the cornea, the iris, the anterior chamber, the suspensory ligament, and the optic nerves. All of that. We are going to look at the function of all of this, the vitreous humor, the retina, and the blind spot, and all of that. We're going to be looking at all of that, and we're going to do the function. Now, the student is advised to take note and do a good job on doing the function, the physiological function of the eye. Over here, we have the dimension of optics and optometrics. And I remember doing the OCAT at Einstein College of Medicine in about 1987. Yes, as far back. Did pretty well too. Almost returned a perfect score in that exam. Okay, and that's the OCAT, optometry school admission test they call it. But this will come under optometry as well, but also this come under medicine. Because with these lenses, if it has any chemical sort of abnormality to it, it becomes under the medical portfolio as well. And we have to use surgical correction of these things, the interface of optometry and ophthalmology. Okay, so we have myopia, short-sightedness, and hyperopia or hypermetropia for long-sight defect, and astigmatism. And here we just show briefly what we have is a normal eye in which the image form on the retina here, convex lens, and in the case of the, this is the normal, no, this is the short side, it forms in front of the retina. This is the image here. Let me just make it a little bit more clearer here. Form in front, and this is a retina here. It forms in front short-sightedness, and for the correct we use a concave lens, and the image is formed precisely on the retina. That's for myopia. For hypermetropia, the image form way out beyond the retina, and for long sight, and we use a convex lens and sort of converge the image, the rays, and it forms on the retina. That's for the correction of hyperopia or hypermetropia. And for here, the astigmatism, we show a little diagram of normal eye, and the rays form directly on the retina here. And for the astigmatic person, the rays are sort of diverge. Yeah, diverge out. And so you'll have, like, you'd have to hold things closer to the eye or that for to see. It's similar to presbyopia, but there's some difference. And you have to use a lens or contact lens or surgical correction of this astigmatism as well as the presbyopia. So normally a lecture in this physiology here, from my perspective, would take about 50 minutes to an hour. I'll briefly concise this introduction into 50 minutes. And I'm going to leave the student to look at the functioning of the eye, and also from the optometric point of view, the function of all the lens apparatus and the correction of the abnormality and all of that. We're going to leave it up to the student to do a good job with this. Yours truly, Professor Dolphy Gilpin, here in the lecture theatre, from the lecture theatre in Decatur, Georgia, and we'll be returning with probably the heart or some endocrine system.